Hello friends, this is Dr. Abdul Mubin A. Mundewadi from Mundewadi Ayurvedic Clinic. In today's video, we will discuss the Ayurvedic herbal treatment of joint diseases. Now, joint diseases can be classified mainly into two categories. Diseases of the joints resulting from inflammation, diseases of joints resulting from degeneration. Now, in actual clinical practice, very often we find a considerable overlap between the two. The common joint diseases mainly encountered are osteoarthritis. Now, this is known as the wear and tear arthritis. The commonest presentation being osteoarthritis of the knees. Basically, this condition results from degeneration of the joint cartilage due to trauma, overuse, obesity, or a familial tendency. This disease is usually progressive. The meaning is that conservative treatment doesn't stop it from progressing. Now, the next type of arthritis is rheumatoid arthritis. This is an autoimmune disease primarily causing inflammation, pain, and swelling in the small joints. Anti-inflammatory drugs, steroids, and immune suppressants can bring about a response, but there is no long-term cure. Most autoimmune disorders affect the joints in the long run. Now, the third category is known as Spondyloarthropathies. Now, this is a group of joint disorders that usually include ankylosing spondylitis, psoriatic arthritis, inflammatory bowel disease associated arthritis, and reactive arthritis, which is also known as Reiter syndrome. Now, most patients have an involvement of the spine, though in a few patients large joints may also be involved. Now, the treatment in this category is mostly symptomatic and supportive. The fourth group of joint disorders includes gout. Now, this is a metabolic disorder with high uric acid being deposited in excess, mainly in the big toe. This can be treated with drugs and with diet control. The fifth category of joint disease includes bursitis. Now, this is inflammation of bursae. These are nothing but fluid-filled sacs which provide cushioning and sliding surfaces for the tendons close to the joints. Now, trauma and overuse are the most likely cause of inflammation leading to bursitis. Again, treatment here is symptomatic. So, these are the five main categories of joint diseases which are normally seen. Now, what is the global burden of joint diseases? Now, as per 2019 estimates, nearly 530 million people were affected globally with osteoarthritis, with nearly 65 million cases in India alone. During the same period, 224 million cases were affected worldwide with rheumatoid arthritis. This is the severity of joint disease and the huge burden it places in terms of economic loss, loss of working hours, severe compromise in quality of life, and not to mention the burden in terms of increased morbidity and mortality. Now, in most households, several senior citizens and middle-aged people, also some unfortunate young individuals, are forced to limit themselves to their houses due to severe restriction in activity resulting from joint diseases. The same story plays out even at the houses of health professionals themselves. Since conservative allopathic treatment has limited benefit, especially in rheumatoid arthritis, while the surgical treatment of osteoarthritis calls for huge expenses which are beyond the reach of most individuals who are paying for the treatments. Now, in such a scenario, it would be worthwhile to consider and review the enormous treatment potential of Ayurvedic herbal medicines for all joint diseases. Now, what is the Ayurvedic herbal treatment of joint diseases? Ayurvedic treatment for joint diseases is with three treatment modalities. The first is local application. Medicines like Narayan oil, Mahamash oil, Vishagarbha oil, Gandhapura oil are used as local application and are followed up with medicated steam fermentation usually using rasna. This is a herb. Now, this is highly effective in relieving joint pain, swelling, and stiffness. The second category of treatment is oral medications. These include herbs like Gugul, Rasnamul, Guduchi, Punarnava, Shunthi, Shallaki, Amlaki, Ashwagandha, Bala, Shatavari, Arjuna, Astishrunkla. These are the medicines which are commonly used. Different herbal formulations are used which contain these medicines. Now, these medicines have excellent anti-inflammatory properties. They are good immune modulators and they can be given safely for prolonged periods in high doses without serious side effects. The third category is Panchkarma procedures. Now, Panchkarma procedures are Snehan, Svedan, Virechan, Basti, and Rakta Mokshan. These have immense additional therapeutic value in bringing about remission in very advanced joint diseases too. Now, a combination of these three treatment modalities can help Ayurvedic treatment to bring about a complete remission in most patients affected with rheumatoid arthritis and other types of inflammatory arthritis. Now, Ayurvedic herbs can repair joint cartilage and help heal advanced osteoarthritis also, and indeed remove the need for joint replacement. Ayurvedic herbal treatment can thus bring about a significant improvement in all types of joint diseases. It is the need of the hour to bring about global awareness about the immense treatment potential of Ayurvedic herbal medicines in joint diseases. So friends, this is a short description of Ayurvedic herbal treatment for joint diseases. Let's meet in the next video. Goodbye.